You've been very, very involved, obviously, in getting the message out around this, as well as in an organization called the American Telemedicine Association. Can you tell me a little bit more about that?
About the American Telemedicine Association?
And what you've been doing in terms of educating around this idea of creating telemedicine solutions and driving that so that more of that actually gets implemented in a primary care setting.
So diabetic retinopathy is certainly a disease that's very amenable to technology such as telemedicine, because so much of what we do in diabetic retinopathy diagnosis is based on what we see. And if you can take an image with the telemedicine technologies available, that image can be sent anywhere. So you can remotely look at those images. You can let people who have the expertise in identifying disease, they can actually see those images and make a diagnosis, even if the patient isn't physically in the office. The American Telemedicine Association has obviously become increasingly important as all of medicine moves forward with technology. And I do believe that more and more we're going to see telemedicine be used so much that, in fact, I think we will soon stop using the word telemedicine and it will simply become a part of medicine and what we do really in medical practice for all specialties. But for ophthalmology, because so much of what we do is image-based, it's actually a perfect medium to be able to use telemedicine.
I agree. To me, technology and public policy have come a long way. And, some people would argue that we're sort of at the right juncture where we really are addressing costs and the issues in healthcare in terms of identifying, where those costs are, where the systems are broken. Can you talk about population health management and how the United Kingdom used their telemedicine platform and their single-payer solution and their technology solutions to be able to impact this particular problem?
So it is very difficult to compare the UK with the United States because the healthcare systems are so very different. But in the UK, they have managed really over the past 5 to 7 years where they have been able to not only identify every patient who has diabetes, but they now are actually having more than 90% of their patients with diabetes are being evaluated for diabetic retinopathy. And a big part of that is being accomplished with telemedicine programs. And they have actually managed to no longer have diabetic retinopathy as the leading cause of vision loss in their working age population. So they've done a tremendous job with that.